y'all are the ones that are at the cutting edge of all of this stuff. I mean, what it's going to be like, just in several years is probably going to be, pretty neat. I mean, just some of the stuff that you can do now, and they're coming out with new stuff all the time, where, attorneys used to have to file motions, whatever. Now they do it online. Everything is done online. Everything is paperless now, just about. And how you send exhibits to the fourth court paperless. So it's done in a picture. Somebody takes a picture of it and then you send it. But all of the papers, all of the, they mark something or they send a copy of, a guy's arrest report or criminal history, all of that stuff. Dating back to, if a parent's had his or her rights terminated before, and they send a certified copy of this thing. You can send a certified copy, and we do it all through the copier now. So I go in there and I copy all of these things. Well, it's copying it onto a file that sends it to my email, and then I save it as a file. And then when I go to connect it onto the file that I'm sending to the fourth court, I just put it as an attachment. And then it sends everything in one file. All of it. And I just sent one this week. There was probably 90 pages of stuff and probably 13 exhibits. 90 pages in one file that I sent to them. And they just go through and, you just kind of scroll down and it shows you every page. Pretty neat. I mean, who would have thought of that? Years ago, we were still sending stuff in hard copies, just as of a couple of years ago. It just went paperless several years ago. So now they don't want anything. They don't want any paper anymore. You file for, an extension or whatever, you have to print out this paper, fill it out, print it, send it to your thing, save it as an attachment, and then you send it to them. But you don't send them the hard copy piece of paper. You send it to them, as an attachment. So, yeah, it's come a long way. Tomorrow's technology. The future of court reporting and real-time reporting is linked to the technology of today. Listed below are some of the advances in court and real-time reporting that will be considered in modern technologically advanced courtrooms. Some of these items have already been implemented, others will be introduced. The technology of electronic tape recording will probably advance, but will not replace the court and real-time reporter as the sole method of recording verbatim proceedings. Modern-day digital auto recording technology will have its own niche in recording proceedings. So even these guys are saying, probably not going to happen. I'm not saying never. And I'm not saying, but they've been talking about it for a long time. Still hasn't. 2, voice-to-print technology most likely will advance and it will be used in low-key situations where accuracy and dependability are important. The technology of voice-to-print will use artificial intelligence to help to decipher dialects and mumbling. Voice-to-print technology will be bolstered by the use of speech-to-text technology, such as voice writing, where one person repeats what others say, and that repetition is instantly translated. Yeah. Voice recognition and voice activation systems will probably continue to be improved and will be used by physically disabled persons. The technology will also be used to perform certain functions and commands. Its application will not be used in court and real-time reporting except to perform certain functions by voice command. For example, editing and printing may be done by voice recognition. Pretty cool. Digital video recording most likely will continue to be used as a viable method of recording events, but the technology will be coupled with a real-time writer. Video text synchronization will supplement the use of digital video recording and text produced by the real-time reporter. The technology of a court and real-time reporter most likely will involve synchronized multi-recording that will allow end users to choose their method of transcript delivery. 1 real-time reporter using one shorthand writer will be able to write shorthand notes on paper tape, record the notes electronically on a disc and video, and audio recorder to a CD-ROM or DVD. Enhanced evidence capturing technology will continue to allow documents, drawings, videos, depositions, and other multimedia presentations to become part of the total record and proceedings. Instant translation will be enhanced by allowing transcription of any language, regardless of the speaker's language. Wow. Translation will also be available in Braille and also closed captioning for the visually and hearing impaired individuals. Pretty cool. The speed of the translation and transcript production will continue to increase remarkably. Using artificial intelligence, all transcripts, regardless of the writer's errors, will be virtually error-free. There will be no conflicts and no untranslates, and therefore no editing. Real-time translation will be replaced by real-time transcription. Wow. Fast input and transcription, fiat, using the shorthand machine and computer with appropriate software can be used by businesses and industries as viable alternatives to the standard keyboard. Real-time teleconferencing and internet web discussions will continue to be real-time for instant viewing via closed captioning technology, and transcripts will be produced on CD-ROM or DVDs that will be able to play back the visual and audio portions of one of the portions of the monitor and be printed, and a printed transcript in another window of the screen. The CD-ROM or DVD can contain all evidence and videos presented during the proceedings and have the capability of linking to the other related cases that are pertinent to the matter. Wow. This enhanced package transcript on CD-ROM or DVD will become the standard of the court and real-time reporting industry. Document repositories will also be a viable method used by lawyers to access the entire transcript. Interesting. Something to look forward to. Any questions about that? Nope.
Like the chapter or that little section?
The whole thing.
Well,
All
even
38
if you're
sections.
just writing crappy, slappy.
It's going to be able to translate it and know what you were writing, because it's going to get to the point where, you know, like it's saying right there, you're going to be writing conflict free.
Does that mean we can go back to conflict-free theories, the original ones?
Yeah, probably.
Get out in 6 months?
Yeah. Yeah. Who knows? By then.
Get out of the machine, okay.
Mhm. What you got, Slick?
Can you help me understand on page 335? You always say to do this, so I don't know how relevant it is, but it's driving me crazy. Under legal terminology, number 6 and 7, can you give me an example?
Legal terminology, 6 and 7. Okay. A dictum is an opinion expressed by the court that is not necessary in deciding the question before the court.
D, 6 and 7.
I have no idea. A dictum is an opinion expressed by the court that is not necessary in deciding the question before the court. I guess maybe it's like a sidebar. You know, he's just making a comment about something that really doesn't have anything to do with.
So that's where because I get that, but then 7 sounds the same to me too, but they're different.
What a dictum means, by the way, or in passing, and refers to a remark or opinion expressed by the court that is not pertinent in deciding the question before the judge. I guess it is about the same. It sounds the same, almost the same to me. They're both an opinion expressed, or remark expressed by the court that is not pertinent in deciding the question before the judge. Interesting. Any other questions?
They said that one, right?
Did that help you?
But it helped me to know that it must not be that important because if you don't know it and you're
Yeah.
a court reporter,
Well, overture dictum is described as a judge's incidental expression of opinion, whereas dictum is a formal pronouncement from an authoritative source. First Amendment dictum that Congress shall make no law, blah, 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 abridging speech. Okay, so dictum is authoritative pronouncement, whereas overture dictum is like he just running his mouth to hear himself talk.
That.
Is basically what they told us when we had to transcribe it.
Yeah.
thank you.
You're welcome, dear.
Does that help?
It does.
Seriously?
Overture comes from the Greek word meaning arbitrary.
You got it from that, but didn't get it from what I told you.
You didn't say anything, you just read what I read.
I told you it was the opinion of the judge. It has nothing to do with it. It's like a sidebar comment. It's just a sidebar comment that he's making.
Overture.
Alright, there you go.
Never mind. You know what? It's not really that important. I don't think it's gonna be on the
When a judge wants
test.
to say something sarcastic about another judge's opinion, it's overture dictum. But when he wants to say something about the issue, not in terms of important enough to affect the decision, but just his comments about the issue, that's dictum.
Got it?
Sarcasm is overture dictum.
Sorry,
Is that on the state test?
So if it's on a
Yeah.
state test and I fail, will you reimburse
I
me
doubt
for
it.
the cost of taking the
Yes.
test?
Yeah. Not.
My
So
$75
nothing to
back.
worry about then.
Alternative careers using court reporting skills. Objectives: discuss what the phrase means, meaning careers from one skill, means in relation to the field of court reporting. Explain how medical transcription relates to the skill of court reporting. Discuss the career of scoping as it relates to the field of court reporting. Describe webcasting and cyber conferencing, and explain the term rapid data entry as it relates to the skill of court reporting. Many careers from one skill. When one thinks about the field of court reporting, one generally thinks of the official court reporter working in a courtroom setting or a freelance reporter working in a lawyer's office taking depositions. This textbook has also been talked about reporters who do closed captioning, such as CART. Generally speaking, in the skill of court reporting is the ability to accurately write on a steno machine at a fast rate of speed what is heard regardless of the situation. Judicial reporters, freelance reporters, CART providers, broadcast captioners, and closed captioners all use this skill. Medical transcription. The working environment of the medical transcriptionist. Medical transcriptionists play a vital role in the health care delivery system. Although not usually visible, they provide a valuable system for physicians and patients by transcribing dictated medical reports that document a patient's condition, diagnosis, and treatment. The medical transcriptionist produces office chart notes, patient history, and physical examination details, consultations, letters, memos, admission notes, emergency department notes, operative reports, discharge summaries, and many specialized laboratory, imaging, and other diagnostic studies. The medical transcriptionist must possess a working knowledge of a grammar and punctuation, formatting, transcription procedures, skill in shorthand writing, spelling and proofreading, and professional decorum in order to transcribe and edit medical dictation for completeness and accuracy. The future of the role of the medical transcriptionist may change as a result of the implementation of the Electronic Health Recorder, EHR, due to an increased emphasis on technology. Medical transcriptionists will need to become knowledgeable about database management and spreadsheet software programs, and they will need to develop enhanced problem-solving skills and obtain advanced clinical knowledge. Yeah, They can find employment in many varieties, such as hospitals, medical centers, medical transcription services, specialized medical offices, and/or home offices. You know, and some of these people do it out of their home, you know? Does anyone know a medical transcriptionist?
I worked as one for a while.
Did you really? How was it?
It's all right. We worked for a derm path laboratory. There's 4 physicians and 12 of us.
Did you use your machine or just?
I said I could use my machine, but we couldn't figure out how to get it to hook up to the technology that they were, system
Oh.
that they were using.
Yeah.
So it was just keyboard,
Oh,
a microphone and then that pedal. Back it up, play it forward.
so you had a dictaphone? So it's just on video, it's on the small little cassettes? The
No,
long-
it was a digital recording. The physicians
Oh,
all
okay.
had a recorder, and
Yeah.
then when they would place it down into the charger, it
Yeah.
automatically downloaded to the system.
Really?
And then based on how many, they have 1,000 cases that day, you click on it.
Whichever one it was.
But they were all numbered.
Yeah. Salaries for medical transcriptionists vary widely according to the geographic area, skill levels, and place of employment. Those working in large cities generally make more than those who work in rural areas. On average, the entry-level transcriptionist can expect to earn twice the minimum wage in an urban area and less in the rural. Some services pay a pre-established minimum rate, providing incentive bonuses to work completed and the maximum expected level of production. Some of the medical transcriptionists are paid on an hourly basis. More experienced transcriptionists who work according to a production basis are usually able to earn more than those paid on an hourly. According to the U.S. Department of Labor, there were 98,000 medical transcriptions employed in 2006. That's a lot. About 41% of the medical transcription workforce worked in hospital settings, and 29% were employed by physician offices. Medical transcriptionists who are employed by a hospital or physician office may also work from home. In addition, some home-based medical transcriptionists are self-employed and work for medical transcription services as independent contractors. According to the U.S. Department of Labor, the median hourly wage was $14.40 in 2006. Was that anywhere close?
I was a little under. I started, but as you improved.
Yeah. What was like the top one making, you think?
We had probably about 14. They made us all sign a contract that you couldn't talk to anybody else about their salary or else it would result in your being fired.
Termination. Wow. Hmm. The transcribed report produced by the medical transcriptionist is a legal record of the care and treatment provided to the patient. The report is owned by the hospital or medical facility where it is originated and cannot be removed from those premises without a court order or subpoena duces tecum. This information contained in the transcribed report is confidential and protected by the Health Insurance Portability and Accountability, the HIPAA. So, I mean, that's one of the big things now is HIPAA. I mean, and it's, yeah, pretty serious. So I guess you have to be really aware of that and not be able to do anything with that information other than, you know, what it's used for. So,
To be a medical transcriptionist, you actually have to go through HIPAA certification and take a test in order to be HIPAA certified every year.
hey, Monday, this class Monday.
Yes.
Okay.
And they're required by HIPAA to report any
Monday.
violations.
Monday.
And if your company has so
Don't forget.
many
Okay.
violations annually, then you get placed on the state's like bad list.
Yeah.
Publicized.
Yeah. It's pretty serious stuff. So that HIPAA is really serious, and they take it serious. So, you know, you can get in a lot of trouble for it.
Is any of this on the state test also?
No. No, I mean, they're just talking about if you don't do court reporting, what you could probably do with the skills that you're probably gonna learn in here. So, I mean, we're not gonna, you know, go through it extensively or whatever, so,
Would it be on the file?
That's all.
no. Probably not.
Should I have it?
Just a
You
yes or-
can.
Just a yes or no,
I know
sir.
about that.
No, no. These probably last couple of chapters aren't gonna, you know, with opening up a business, probably not gonna be on there. So, you know, and I think we've covered pretty much what we were gonna cover about it. I mean, you know, just what it is, and that's what it is. You know, and then Rachel kind of filled us in as, you know, to kind of what it is. What they do is they dictate all of this stuff on a recorder, and you've seen it. I mean, have you guys ever seen that before? Where the doctor will come in and, you know, he just has this little recording. He's just like, yeah, patient David Zarate, you know, 45 years old, blah, 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 complaining of blah, 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 has symptoms of this and that, and going to put him on this kind of medication and see him in 2 weeks.
We actually had books of them, each doctor would create their own macros.
Yeah.
For us to make it easier, but you had to, whatever doctor you were assigned, you had to learn their macros because each doctor could not have conflicting macros. So if you were to write it, it would accidentally create another one.
Oh,
So it
really?
would make it faster for us.
Yeah.
Because like actinic keratosis,
Yeah.
melanoma, all those
Yeah.
ones are
But I mean, he's saying all the time.
M3, T2, M9, 2006. And you
Mhm.
put it down, you just put in the codes. And you'd have I forget, there was like a keystroke you would do and you write the macro number,
Yeah.
you know, T7, and it would,
Mhm.
and you just keep going.
They're pretty neat though, you know, and how far it's come. Okay. We're gonna go to scoping. So, you know, and I think most of you know what a scopus is. You know, it's somebody who helps a court reporter, you know, go in, listen to it again, make sure that everything is correct, speaker identifications are correct, punctuation is correct. A scoping